do you get one? What are the common types? How do you know that you have one? How can they be treated? Most important of all, how can they be prevented? These are all questions we'll try to answer. As we go through the video, we'll ask you several multiple choice questions. Write down the best letter choice and bring your answers to An STI is a sexually transmitted infection, oftentimes referred to as an STD or a sexually transmitted disease. It is contracted primarily through sexual contact with someone who is infected. There are over 30 sexually transmitted diseases such as chlamydia, gonorrhea, herpes, genital warts, and HIV. 19 million new cases of infection are reported per year. Some can make you sick, some can make it so you'll never be able to have children, and some can kill you. First, let's try to understand how STIs are transmitted. STIs travel from one person to another through some sort of physical mechanism. Sex is the most common way for STIs to infect people. In fact, STIs are primarily contracted through sexual intercourse, so we'll put it first on our list of transmission. What makes sex such an efficient mode of transmission is direct contact of bodily fluids, including semen, vaginal fluid, or open cuts. The second common way of spreading STIs is through sharing needles that infected people have used for shooting up drugs, piercings, tattoos, or gang rituals. Imagine a scenario in which the needle tip contacts an infected person's blood. Then that dirty needle tip is shared with an uninfected person, and boom, another person is infected. The third, less obvious STI route is from an infected mother to her newborn during birth or breastfeeding. So let's review what we have learned. First and most common route is through having sex. The second, through sharing needles. And the third, through breastfeeding and birth. A key point here is that one can get a sexually transmitted infection without ever having sex. Another important point about sexually transmitted infections. Both men and women, homosexual and heterosexuals, old and young, rich and poor, can get STIs. So it's not who you are, but what you do that puts you at risk. STIs do not discriminate. STIs are caused either by bacteria or viruses. How do you know that you have an STI? Most STIs are characterized by abnormal secretions, itching, pain, or sores in the mouth or genital areas. When you experience any of these symptoms, see a doctor. Tests can be done for a diagnosis. Infection caused by bacteria can be cured with medications, such as antibiotics. However, viral STIs cannot be cured with antibiotics, but some can be controlled to varying degrees with medication. We'll now focus on 3 important STIs: chlamydia, herpes, and HIV. Chlamydia is the most common STI within the United States. 73% of these cases are reported by people under 15 to 24. This infection is caused by bacteria, and if caught early on, chlamydia can be treated and cured with antibiotics. Oftentimes, chlamydia is usually mild and therefore hard to identify before it is spread to another individual. However, a simple urine test is often used to determine if chlamydia is present. Many people do not recognize the problem until serious complications arise, such as infertility in women. Chlamydia may also increase the chances of becoming infected with HIV if exposed. Genital herpes is the most common viral sexually transmitted disease. It affects about 45 million Americans, or 1 out of 6 people in the United States. Since it is a viral STD, it cannot be cured by antibiotics, but antiviral medications can help prevent or shorten the outbreaks. Most individuals infected with herpes experience either no symptoms or very mild symptoms. Because of this, many people infected with herpes are not aware of their infection. If symptoms do occur, they appear as blistering, flu-like symptoms, swollen glands, sores, and skin marks resembling insect bites near the mouth and genital areas. The physical symptoms are called outbreaks. Repeated outbreaks are common, but they are typically shorten in length and number over a period of years. Herpes can be diagnosed either through a visual inspection during an outbreak, a tested sample from the source, or through a blood test. The blood turn our attention to HIV, or the human immunodeficiency virus. The life cycle is divided into 3 stages: primary infection, latent or resting phase, and full-blown AIDS. In primary infection, individuals infected with HIV through unprotected sexual intercourse or by sharing needles. After entering the body's bloodstream, the virus travels to the immune system where it replicates rapidly. A person may display flu-like symptoms for a couple of weeks or months, but then it will go away. Despite the mild symptoms, a newly infected person is quite contagious. In fact, nearly 50% of HIV transmission occurs within this narrow time frame. During the latent or resting phase, the virus hides within the immune cells and stops replicating. The length of the latent phase varies widely and can last from 5 to 15 years. It's only in the last stage of the HIV life cycle that HIV comes out of hiding and leads to AIDS, or acquired immunodeficiency syndrome. The virus now destroys certain immune cells responsible for the body's defenses. As a consequence, germs that do not cause significant illnesses in individuals with a normal immune system can now do so in individuals with weak or no immune system. These infections are called opportunistic infections, which often cannot be treated or controlled. In other words, people with AIDS often die of these opportunistic infections. To date, HIV and AIDS have no permanent cure and no vaccine. Yet, with certain prevention and medical strategies, it is possible to delay the onset of full-blown AIDS and postpone death. Early diagnosis and treatment with antiviral medications called cocktail drugs can improve the health outcomes of many patients. Today, an AIDS diagnosis is not an immediate death sentence, and every year more and more people with AIDS survive. With AIDS survive. So by now, you have learned about the undesirable consequences of contracting STIs. The good news is that they are totally preventable if you know what to do. You have also learned how STIs are transmitted, mainly from having sex or sharing needles with infected individuals. So to prevent contracting an STI, one should not practice this type of behavior. For teenagers, not having sex is the most common way to prevent STIs. Did you know that most of the teenagers today, in fact, do not have sex? However, for those who are sexually active, the smart way is to practice safe sex. Simply put, safe sex means using a condom from start to finish of the sexual activity. So why a condom? Well, it acts as a physical barrier to prevent the exchange of bodily fluids. And without the exchange of bodily fluids, no bacterial or viral STIs can be transmitted. Sounds simple, right? It is, but it's important to learn how to use a condom properly so that you and your partner are well protected. So make sure you read and follow the directions carefully before you use it. Also make sure that the condom is stored properly and not in heat for an extended period of time. Make sure that it is also intact and within the expiration period.